All right, can everyone see that okay? Perfect, see some nods. So like Michelle said, my name is Kate Feuling Porter. I work at Twin Cities Medical Society, and I have been doing tobacco work with TCMS for about just 3 years now. And Betsy.
Hi, everyone. I'm Betsy Brock. I worked in tobacco control for around 13 years, and I was the co-chair of the coalition of groups that work to restrict the sale of menthol tobacco in Minneapolis. So the other group, I worked with the Association for Non-Smokers Minnesota, and the other group that was co-chairing was North Point Health and Wellness. And now Jean.
Yes, good morning, everyone. Thank you for being here. I'm Gene Nichols. I'm a retired 3M'er, and upon my retirement around 12 years ago, I decided that I needed to continue doing work to make sure that we reduce the disparities in this wonderful place we call Minnesota. And I've been in the tobacco work for over 10 years. Good to be here.
Awesome. Thank you. So just a caveat, the three of us agree that we could take hours, if not days, to just start talking about commercial tobacco and menthol specifically. So this is going to be sort of a whirlwind presentation and just ground setting. So we all have at least somewhat of a shared foundation to talk about the rest of this session, which will be a panel on menthol and building that grassroots movement. So a summary of our advocacy work across the three of us is at one point or another, we've all been a part of the coalition Minnesotans for a Smoke-Free Generation. Some of us still are. It's a big coalition with 60 plus organizational members. Answer Minnesota, which Betsy and Jean both mentioned and have been involved with. Jean did work on a SHIP grant specifically for menthol. There's also a Ramsey County Tobacco Coalition. And those are just some of the ways that we've plugged into this work. We are going to be primarily focusing on menthol campaigns in Minneapolis, St. Paul, and the Metro. That's just where our experience is, but that there are so many different, we have partners across the state doing this work all over communities, up north like Duluth, Western Minnesota, all across the state. And the main policy approach that we talk about when we talk about doing menthol tobacco prevention work is looking at restricting or banning the sale of menthol flavored commercial tobacco products. So I had to add this slide in. As some of you may know, yesterday the FDA made a huge announcement responding to a citizen's petition that I believe was filed in 2013, where the FDA just yesterday morning announced plans to ban the sale of menthol cigarettes and all flavored cigars starting in the next year. This will probably take a while to be implemented. I'm sure the tobacco industry will run interference on this, but this is huge, and I'm personally still processing what this means for the movement because it's really big and really good news. And now let's talk really briefly about what menthol tobacco actually is. The tobacco industry has unfortunately done a great job of marketing and really positioning menthol tobacco as not being a flavored tobacco product. Often it's included in exemptions from flavor bans. But menthol tobacco is minty. It's often grouped with mint or wintergreen flavored tobacco products. There's menthol cough drops that we're all maybe familiar with, or menthol chapstick. It's cooling, it masks the harsh taste of nicotine, and it also helps numb the throat, which makes it much more palatable and easier to tolerate. Tobacco is really harsh and nicotine is really harsh on the throat. And people who use menthol flavored commercial tobacco products often have a harder time quitting and report higher levels of nicotine addiction versus those who use other products or perhaps use unflavored, because it's just that much easier to palate and tolerate. And so we'll spend a lot of time kind of later talking about tobacco industry targeting in different ways, but this is sort of a really brief history on targeting with menthol. Menthol was first added to cigarettes in the 1920s, but by the 50s, it was really widespread. Menthol flavored tobacco products were actually originally developed for women. But for decades now, the tobacco industry has systematically and aggressively marketed menthol products to Black communities. And also they started a while ago now, also marketing it to LGBTQ+ communities. And this is just an example of a quote. So both of these are 40 plus years old. Unfortunately, I would say that this is mostly still true. Maybe just the reality in the landscape looks a little different these days. But kind of an infamous quote from an R.J. Reynolds executive saying, "We don't smoke that, we just sell it. We reserve the right to smoke for the young, the poor, the Black, and stupid." And then a 1978 quote from Newport saying, the base of our business is high school student. So really they didn't hide it then, and it's still not as hidden today either. And then this is a screenshot from the Beautiful Lie, Ugly Truth website. This is a wonderful campaign that Answer and North Point kind of worked on together. This is a website you can still visit. These are just ads from different magazines over the years of specific menthol advertisements. You can see most of these are targeting and marketing to Black smokers, and there's also targeting to LGBTQ communities too. And if you just do a Google search, it's really wild and alarming, the ads that are out there and really aren't that old. And now I'm going to actually share a video. It's about 1 minute, 45 seconds, and then we'll jump into our panel. But this is a video that was created in partnership between Answer Minnesota and North Point Health and Wellness. Can everyone see a black screen right now? Perfect. I'm going to reshare and make sure I shared my audio actually. Okay. Cool. So this was developed in partnership with Answer and North Point Health and Wellness. This features, it was worked on with local Black media experts and professionals to develop it. And the poet and spoken word artist that's featured is Joe Davis. And I think he's pretty well known now in the Metro. So I encourage you to look into his work. So I'm going to play this.
Ever since it's been around, just a spoonful of menthol helps the poison go down.
Smoke-related illness is killing us, disproportionately Black men and youth.
Far surpassing any other drug, disease, or car crashes. And it's no accident.
The ashtray leads to our ashes.
Sin embargo, esa no es la historia que ustedes nos cuentan. Ustedes, con sus anuncios, disfrazan el sabor de la muerte. Ustedes no nos dicen las tasas de la mortalidad, tampoco nos dicen lo que vamos a pagar, la deuda por cada aliento.
You're betting on us to ignore the Surgeon General's warning.
You improve profit margins when you profit off those in the margins, making us think you're our friends by giving us a bargain.
Like a van, parked out on the corner giving away free sample cartons.
It's all addictive, and menthol makes quitting even harder.
It's disgusting to see how you focus your campaign on the young, Black, and dumb.
That's the way you described us, saying, the younger the better. Black lungs don't matter, as long as our pockets get fatter. We don't smoke it, so it don't matter.
We're not buying these lies you're telling us. It's all just smoke, you're blowing us.
R.J. Reynolds said he'd never smoke it, but he's selling it to us. Sponsoring our favorite concerts, movies, and magazines. But we're here to tell you that we're on to your scheme. We see the ugly truths behind the smoke screen, the beautiful lies that we won't believe.
Stop selling us these beautiful lies and ugly truths.
Cause we ain't buying them.
Cause we ain't buying them.
Cause we ain't buying them.
Cause I ain't buying them.
All right. I'm also going to share that link in the chat. Oh, perfect. Thank you, Michelle, for linking to Joe Davis. And here is a link to the YouTube video if you ever want to watch it again. I don't know how the audio was, and YouTube captions are always kind of interesting. So go ahead and check that out if you'd like to. But we are now going to start our panel, and then we'll leave some time at the end for questions as well. So please feel free to put those in the chat or wait till the end, and we'll definitely have some time for that. So hopefully from that really whirlwind presentation on menthol tobacco, you've gathered that there are some really serious health disparities that show up because of menthol tobacco, especially in Black communities. So we're going to kick off with our first question. And this is sort of a multi-parter, so it's a little bit cheating, but Betsy and Jean, how did this movement change or pivot or grow when it wasn't upholding anti-racism in your work?
I can start. So in 2015, we had a coalition of groups. So North Point, my co-chair at North Point on our coalition, her name's Latricia Vita. And so Latricia and I were working on with a group of youth who were working with a city council member in Minneapolis on restricting the sale of tobacco products that were flavored with flavors other than menthol. So like cherry cigars and grape chew. And so we were kind of in the midst of working on that. And at that time, people weren't really sure what local governments could do about menthol, because FDA had come out and said that they weren't going to regulate menthol at that time. So we were focusing on these other flavors. And in the middle of that kind of 2-year campaign, Chicago restricted the sale of menthol tobacco. And so it was definitely a moment where there was a lot of division amongst tobacco control partners locally and nationally, because there was a group of people saying, well, now you should just go ahead and include menthol in your policy that you've been working on and get that dealt with. And we were saying, Latricia and I and a lot of the coalition members were saying, you know, menthol is really different than these other flavors. It's I think it's something like 88% of Black smokers smoke menthol. So this is an issue for the Black community and Black smokers and Black adults, whereas we saw the grape cigars as primarily kind of a young person thing. And so we felt like we needed to do a lot more outreach to the community, education to the community, to explain why we would even take on menthol. Because it was our experience that a lot of people in the community, they had seen all these Newport ads and they had seen, for years in Jet magazine and Ebony, but people didn't connect that tobacco industry was targeting the Black community. A lot of people in the Black community were just saying, well, we just like menthol. Like, that's just how it is. It's like, well, yeah, because the tobacco industry specifically targeted your community for decades. So we felt there needed to be a lot more education. And so that was a really difficult point in the work. We had a lot of people basically saying, you don't care about Black people, you're racist, you want them to keep dying. And we were saying, no, we want to deal with menthol, but we want to do it right. And sometimes it's the criticisms from your friends that hurt the most. So that's where we kind of went back. We finished up our dealing with the other flavors. And that's where we started working on our campaign that you just saw. So we worked with a local Black designer and PR person who helped us come up with the messaging around Beautiful Lies, Ugly Truth, helped us kind of really flesh out this campaign to explain to people in the community that menthol it's a racial issue, and it's not racist to take menthol away. What's racist is how many Black people are dying because of menthol. So it was a long community education process that we had to go through. And I'm really glad we did it that way, but it was also a very difficult kind of transition and moment in the campaign, I guess I would say. So that's a pretty long answer, but.
Thank you so much. And that reminds me, I was in a session yesterday where they were talking about signs of white supremacy and coalitions, and how a sense of urgency can be one, and how slowing down and listening and then handing over power to the community is the best thing you can do. And if it takes longer, that means it has a higher chance of being done right. And Jean.
Yeah, I'll just add one thing quickly. Betsy nailed it totally there. But the one thing I'll add, so in 2015, MDH issued this grant that as a community-based organization, which I was a member of, designed to really understand what African Americans in the community felt about menthol. So that program started out with first doing a baseline survey, how do you feel? And the education program that Betsy was talking about, we incorporated that. We went back to the community and did multiple education programs in St. Paul, Minneapolis, Brooklyn Park, Brooklyn Center, Bloomington, Edina, Richfield, into the community. And then we surveyed the community, and what a difference, and so the one horse that I'll probably talk about through these questions is education. That education really made a difference where, yeah, we knew what was going on, but we didn't understand it. We didn't understand menthol and what it was. It was like a cough drop, Vicks Vapor Rub. People knew that, but couldn't put the two together. So I think as a result of that, I think we had more people who understood it. And, it like morphed into, well, this is sort of a racist attitude, but how can we turn that around to work in our favor? And that's the work that's been done, continues to get done in the local policy area. And I'll stop there in the interest of time.
Thank you both so much. Yeah, I think those are both huge parts of it. And both involve kind of slowing down and like pausing to really be intentional. Here's another multiple part question for you. How can advocates step back and actually let community lead? This also relates to public health values, or things we strive for, at least, to do no harm. And if you do harm, be accountable. And also, I'm going to tack on more, how do we overcome imposter syndrome? There's not one answer to that, but I think that's a part of it.
Well, I'll start out with that, and that is a huge question. Thanks for asking that. But I said earlier that I'm really going to hop on the education, and I think one thing that's very hard for us as advocates to do is step out of the way, right? Because we have all the answers, we know everything, we think, but it's that lived experience in the community that makes the difference. And I think that's what's been making the difference in our work. Once we educated in a number of ways, the work that I did, other partners were doing education in the community. Once that education was done, people stepped up to the plate and began taking ownership of their health. Because I think they understood it wasn't about what I like to do, but hey, I recognize that my father died of lung cancer. My aunt died, my mother died, family members have been dying forever. And I remember the magazines. So there must be something to this. And so it was so pleasurable and so important. I called them my change agents who were doing the education, who came back and said, Gene, I got other people who want to be change agents. They want to do the education in the community, and we did allow that. So I think that's part of it. I don't know, Betsy, if you want to pick up.
Yeah, I think in public health, my experience is that in like the public health sphere, a lot of us who work in that sphere are white women. And so sometimes it can be hard to show up into community because we think, first, maybe we feel uncomfortable, but also maybe we think we have, we show up with all of our fact sheets and our numbers and our statistics, and we just want to, rattle those off. And sometimes the best thing to do is just sit back and listen, to people's experience, and maybe it challenges what you think, but maybe that's what you need. And I think sometimes as white people, when we show up in spaces of community, we also are afraid to speak. We're afraid we're going to make a mistake. And so that can also be a problem. So sometimes we talk too much and sometimes we don't talk enough. So I think it's finding a right balance of listening, maybe being open to, what I talked about before, that we were, people were calling us and saying, you need to work on menthol right now. And the majority of people saying that were white public health people. And we were saying, but that the community is not ready for it. Just because you're ready, the community isn't ready. And so I think sometimes just kind of taking it in and saying, wait a minute, maybe I'm putting my own values on the community and I should be listening to the community. I can learn a lot is really important.
I'll just add one more thing, if I can, Kate and Betsy, about accountability. As we move along through this process, and at least the processes that I've been involved in, community members began to see, some, not all, began to see that, I need to make a change in my life. In my household, I'd like to quit, but everyone else is smoking. So how do I manage that? And people called me to say, give me tools so I can help my brother stop. so that I can go and receive the support I need in terms of cessation. So it was like a community being accountable to each other that really, I think, helped make a difference in some lives. Not all, we have a long way to go, but that's the accountability piece I wanted to speak of, to each other.
I love that so much. Thank you. So a shorter question, but maybe one of the bigger answers that we'll have is, what are some of the barriers that you encountered in the menthol campaigns that you worked on?
You want me to start, Jean? Or?
Yeah, I'll start. I was
Okay.
waiting for you to stop. No problem. I think there were two barriers in the menthol work. And I said I was going to beat this horse up. One was people just didn't understand what I was talking about in terms of the effects of menthol until we actually educated them. One of the problems I have is that even today is that once that grant was over, there was no additional monies provided so that we could continue the education. The thought was that the community would be engaged to continue their own education, and some did. There were some members who did, but it just wasn't broad enough. It was a broad effort that we started that right now there is very little real education going on, funding for that. So that's one of the barriers. The other barriers, I think, relative to menthol is, just the racism in the overall systems in Minnesota. There's just a total lack of understanding that the disparities are we can see it among the race, Black versus white, and everything with cancer, lung disease, COPD, a huge disparity. And everybody recognizes it, but nobody's doing anything. And I think that's a barrier, because every year we look at the statistics, and then I won't say the disparities get wider, but they don't go away. That's a huge, huge barrier when people look and say, well, what are you really doing? You're taking this away from them. What's been the results? So I think that's going to continue to be a barrier until we're able to show the changes that we're, from a health perspective in the industry.
Oof, there were a lot of barriers. I'm trying to figure out what you want to talk about. I think Jean hits it. There was just, especially with menthol, it's such a racially charged issue, and approaching it in the right way was so difficult, and it was kind of scary, to be honest. Like, are we doing this right? Are the right people at the table? Those are the types of questions I asked myself a lot. And we got just so much opposition from the tobacco industry, the tobacco retailers, who are saying that we were going to put them out of business, and they weren't going to be able to feed their family. And it was hard to hear those messages, because we do have compassion in public health, especially, and we don't want to think that we're hurting someone in that way, but we also have to keep our eye on the prize. Like, community members are dying. You're selling products that are killing people. And so, that was a barrier. There were national partners that could sometimes be a barrier, both ways, people that were pushing us to go further, go harder. And then the tobacco industry was sending in people like Al Sharpton to speak against our policy. He came to Minneapolis to a church, and he was saying that, we were trying to criminalize Black men in particular. And so that was a barrier. So it was just a very charged issue. And sometimes I know I felt sort of like, is this the right thing? Are we doing the right thing? And it was, that's why it was so good to have a big coalition of people that could talk out and lift you up and say, yeah, this is right. We're doing the right thing, even though it's hard. So it was a very challenging policy campaign.
Yeah, thank you both so much. I think it's hard to kind of wrap your arms around like articulating all the challenges, because it is hard, but worth it. But it's that commitment and that long-term commitment and belief that it's the right thing to do in community. So kind of building on that, what are some key lessons that you learned in your work from menthol campaigns and the menthol movement?
So I'll start this. We're running a little bit out of time, so I'll be brief. I think the major thing that I learned and the work that I continue to do is that most people who are against the work that we're doing are not looking at it from a health perspective. They're looking at it from a corporate greed perspective. You know, my shop is going to go out of business. Well, get a new business model. There's a lot of things that are missing in the community in terms of fresh fruits and vegetables that would bring in higher yield than a pack of Newports. The larger groups that are working against us, say we're criminalizing, you know, they're looking at it, and I understand that perspective. Trust me, as an African-American male who grew up in this world, in this society, I understand exactly. But I have to keep in mind, you know, that my brother was killed by just this use of this tobacco, and he didn't know. And I really feel that if I could have educated him and told him what was coming, and you know, we all know, you've been in healthcare, we know about the invincibles, right? You know, nothing could hurt us until you get to that age when everything starts happening. And I think that's what this is. I don't think people understand the health impact. And we can't say it enough. There is a direct link to long-term addiction and health problems when you use these products. And I can't think of any other product that's on the market today that brings such death and destruction to family than cigarettes. And that's the message that we have to continue to spread. So that's what I've learned from this work in Menthol.
I think one thing that's worth mentioning that I think we did well and is a good lesson for other health topics is, especially with something like tobacco, I mean, we're dealing with a true addiction. And we know it's one of the most powerful addictions that people can have. So we were very, very conscious about, we wanted to place the blame firmly on the tobacco industry. We didn't want to say, oh, you just need to quit, and you know, what's your problem? Like we didn't, because we know people feel shame. A lot of people feel shame. They want to quit. They've tried to quit many, many times. So we wanted to say, no, like this is bigger than you. This is systematic. This corporate industry has been targeting you for decades and has made millions and billions of dollars off of your community. So I think that helped reframe the issue, and it mobilized people who may not have otherwise really cared. It was sort of like, oh wow, like you're right. They have targeted my community. They are killing my family for money. And so I think that's the key lesson. I mean, especially as maybe people think about working on food policy or other things, you know, there are similarities. You know, we're talking about giant corporations that, you know, have made products that are harming communities, and they've altered their products in such a way to make them, you know, more attractive. And so I think that's important to keep in mind, because I think sometimes in public health, we focus on the individual, and especially with things like food or tobacco, there can be a lot of shame around that. And so I think that was a big lesson, and I think we did that well in our campaign.
Absolutely. Thank you both so much. And yes, all these industries really benefit off of that kind of individual behavior thought that's been fermenting for decades in our society, I think. And that's really beneficial to industries to kind of keep it there. So I think reframing to systems, which is the actual problem and part of this and the solution, is a great lesson, and working in community and education. We did great, I think, with timing. So I think now we have some time to take questions from the audience. So I know we would welcome any questions you have. And also if there are topics that you'd like Betsy or Jean to expand on that we talked about a little bit, that'd be great too. And also feel free to share in the chat, because I personally am usually too shy to ask questions in Zoom groups. So I'm very empathetic to that.
Can I start with a question? So I had the privilege of being part of this work, and now I'm working on some other topics that are just very far behind in that systems kind of lens. And so I'm curious if you had any experiences in menthol work where you saw people shift from thinking about kind of the individual blame or shame into that systems mindset? And like, were there any tricks in getting people to kind of toggle that over, or did the ads and the evidence just really do that for you?
That is a good question.
Betsy, do you want to take that with your experience with North Point?
Yeah, I think for us, showing the ads, and you would see people sort of have an aha moment where they would say, oh, wait a minute, I remember seeing this, on my grandmother's coffee table in Jet magazine when I was, 8 or 10, and I get it now. And so I think like showing those things but reframing it and saying, look at what they were doing here. They're really specifically targeting your community, especially at a time when maybe people weren't seeing a lot of ads that had people that look like them. So I think that helped. I think the documents, but these are all the documents that showed these horrible quotes, but these are all things that are kind of specific to the tobacco industry. But I think, I could imagine kind of trying to recreate that with like the food industry, maybe ways that, some of these food companies have targeted certain communities or targeted children with, certain foods. So I think we were lucky that we had a lot of evidence, decades of evidence that really spoke for itself.
As usual, Betsy, you nailed it. And I'll just add, I think as a result of that work, organizations like Clearway, Minnesota, and who was doing the work on the ground at the local work, they were informed of what actually the result of that, right? I mean, it helped them and others, MDH, to be more specific about what they do and how they go about what's needed back into the community. I will say at a level, there was some listening, especially along Clearway and a number of, Clearway has a great many partners, and that was very effective getting it to the partnership. So there were some good things that really helped out. Thank you for that question, Annie.
Well, thank you too.
Great.
So if I could just add before another question comes in, I don't know if there's anything in the chat. One of the things that we all can do, just like we're hearing now around, policing and the other issues that are going on in society today, tobacco is a huge issue in communities. We did a great job of separating commercial tobacco from tobacco that's used in the indigenous community and the Native American community. We needed to do that because there's a difference. The difference here is that this tobacco, commercial tobacco, is killing us, and it's killing all of us. What's good for you is good for me. And whether it's tobacco, whether it's menthol or all the flavors, we've been talking about menthol here primarily, but flavors have the same thing. It goes deeper into your lungs, and the deeper it gets into your lungs, the more horrific results result from that process. So anyone in this session today who wants to get involved in this work, please do. We need everybody's assistance. It shouldn't be looking at any one community. It affects all of us. It's an insidious problem for all of us.
Thank you so much, Jean. I was just going to put in the chat, but I'll say it now. A plug that absolutely, and you're all welcome and encouraged to join our coalitions as well. Menthol Coalition, Minnesotans for Smoke-Free Generation. There's a lot of really great community work going on. Any other questions or thoughts that folks have? And thank you so much for joining us on this beautiful Friday morning. Hopefully it's also beautiful wherever you're watching from. I know one thing I did want to just maybe expand on a little bit and ask you before we kind of get booted out of here is linking back to barriers, but also lessons. I think we've talked, I think all of us at some point in our work in public health have experienced barriers with funding, but especially when you're doing community work, grants are great, right? But there are a lot of barriers or expectations or reports that are due with grants. And I personally think that's a huge barrier to communities, and that really, there's a lot of privilege in having that knowledge to be able to navigate that world. So I don't know if you have an answer or if you just have any thoughts, but are there barriers you've experienced with funding or flexible funding that's worked really well for you in your work?
That's a really good question. And in the time we have, I'll just say this. What I'm learning is that intersectionality is very important. There are a lot of people who are doing work, let's say in the mental health area or the addiction, drug addiction area, that we're really connected. And if we start combining our resources, I think we could do a lot better work, not only educating each other, but be more powerful as we move out into the local and state arena to make the changes that we want to make in our own programs that we're working in.
Absolutely. Thank you so much. We could spend a lot of time talking about funding too. There's one question that came in the chat. Thank you, Ellen. So in the last minute or two, Ellen says, I grew up in the South, very much in the Philip Morris territory. I'm curious to learn more about what this work has looked like there to combat generations of targeted ads and the enmeshed relationship of tobacco companies and the communities. So if either of you have any thoughts on kind of more specific work to combat marketing.
It's really tough down there. It's a lot tougher. They're a lot farther behind. And a lot of that is because of what you said. I mean, a lot of people work for those companies, but also because those companies have made a specific effort to really restrict what local governments can do. So they pass laws at the state that say local governments can't enact policies like this. So that's one big problem in a lot of these states. That's why they can't go any stricter and they can't pass policies. So we're fortunate that way in Minnesota. But yeah, it's really unfortunate.
The other thing is we're working at Answer on a project that talks about when the enslaved were used in the tobacco in North Carolina and around the South, how it started, right? That whole economic piece. So we're working on that paper now. We're putting together a program. I think that will give you the background and maybe support to how it was allowed to exist and how it exists today, even though there's not much going on.